Hi, I'm Dr. Michael Cottom. I am a pediatric dentist and the site director for the Roseman Dental Clinic that is co-located in the Cure for the Kids treatment facility. The mission of this clinic and the partnership between Roseman University and Cure for the Kids was thought out and designed to bridge a gap that we recognize in children's health care. And specifically that gap is that for many families who have a child who is struggling with some kind of systemic disease, be that cancer or a bleeding disorder or any of a number of things, it can be very challenging and difficult for the child and family to receive appropriate dental care.
One idea that we are focused on in pediatric dentistry is the ability to provide a dental home to every single child. That is, offering comprehensive dental care in a coordinated, continuously accessible, and family-centered way.
Orthodontics is a procedure in which we move teeth from ages 7 to 77. Allows us to increase confidence for patients. It allows us to correct and normalize jaw growth. At age 7, many children do not have all their adult teeth, but there are still bones that are growing that we can help to normalize through different growth modalities. At age 77, while the bones are stopped growing at that point, we're able to correct the teeth and put them into positions where patients are happy with their smile again.
Cure for the Kids and Roseman University felt that anything that we could do to make any of that constellation of challenges easier was worth doing. So we've started on that journey by locating a specialty dental clinic here in the building right next to the Cure for the Kids facilities.
We want to make sure that we are accommodating every aspect of our patients' lives and our employees to be able to provide these services to them, not only in a way that is efficient, but also affordable and high quality. Our clinic uses the newest technology that we have. We're using digital scanners with infrared capabilities to detect cavities, sometimes without taking x-rays. A lot of software that is integrated with artificial intelligence to help us not only surgically plan implants, but place them with high precision so that there's little room for error.
The university and clinic have received a huge amount of very generous support from a number of high-end dental equipment and supplies manufacturers. These companies and so many others have offered very generous support, both financially and in terms of the equipment that we have here.
Another exciting aspect of our practice is that even though we are located right here with the Cure for the Kids Foundation, our clinic is actually open to children and families of our Roseman and C4K employees, siblings of our active Cure for the Kids Foundation patients, and anyone who is affiliated with all the families that we see here.
When you have children in general coming into a dental practice, you want it to be kind of like a family practice, a family environment, something that everybody's coming in and seeing kind of similar providers. And so it was just kind of a natural transition to move that way. And so going forward, we're starting to see not only the patients from C4K, but also their parents, their brothers, sisters, moms, grandmas, immediate family members. And so we're really excited about that, and it's been pretty rewarding so far.
We are excited to welcome our doors to everyone. We offer comprehensive oral care for kids who are anxious. We have laughing gas, we have sedation. Our facility is even equipped with the ability to perform general anesthesia right on site.
First and foremost, the biggest consideration we have to make is orthodontics is by and large a completely elective service. Nobody needs it, although many people will benefit from it. But when medical conditions such as what those children at the C4K clinic are undergoing treatment for, orthodontics, we're fortunate that we can delay that type of treatment such that they get the real care that they need at the time they need it, and that is for correction or treatment.
That combined with the fact that in a university setting there is no financial motivation, so you don't need to worry about going into an office and wondering, okay, do I really need this crown, or would a filling be adequate? Here we have no financial motive. We're nonprofit, so our only objective is to provide high quality care that is as conservative as necessary for the patient, which I think is another unique aspect of this clinic.
Sometimes it's more about remembering that there's a person attached to those teeth. A cleaning isn't just a cleaning, this is a medical experience. And let's say for a child who has spent a lot of time in physicians' offices and maybe in and out of the hospital, or has a number of needle stick experiences because they have they need to get a lot of blood draws or infusions, or those kind of medical experiences. Dentistry is one more medical experience, and so it's entirely possible that there are extra stressors here that are part of this child's experience and outlook to medical care of any sort.